Well, we can speak now to Margaret Harris. She is from the World Health Organization. She joins us live from Geneva. Many thanks for joining the programme. As an organisation, have you ever seen destruction of health facilities on this scale before, as you've seen in Gaza?
Good evening, Marlene. We are seeing more and more concerning attacks on health, actually around the world. We've actually seen it, for instance, in Sudan and Ukraine, but certainly the speed, the intensity, the complete destruction of a health system. As you said, 30 out of 36 hospitals damaged, very, very few hospitals left in the Strip able to provide even the most basic services at a time when you've got millions of people who are desperately in need of care because of not just their physical injuries due to bombardment, but their infection, their rising levels of infection due to overcrowding and also starvation and malnutrition.
685 healthcare workers that have been killed and injured 902. Those are your numbers. Doesn't that sound incredibly high?
It is. It is. And it is also shocking that since we began documenting attacks on health, the numbers have become have risen so rapidly. It's very, very clear in international humanitarian law, and this was one of the first of the agreements around the rules of war, that healthcare must be neutral, must be protected, because healthcare is something for everyone. Doesn't matter whether you're fighting or not. Healthcare is something that all societies need. It's a basic human right.
Do you think Israel is deliberately destroying Gaza's health system and infrastructure?
So that is really something for the analysts. What we are simply seeing is that there is destruction, and this is making it harder and harder for those who are simply trying to provide life-saving care to a large population of people, not only the people who are injured, but people who've got ongoing illness. We're now seeing so many people who are no longer getting their cancer treatment, who are no longer getting their diabetes treatment, who are dying of things that they would normally be able to overcome, or who would be able to live a normal life, but they no longer have access to the care that's a basic human right.
And it's the healthcare workers as well, isn't it? You've released a report today saying that health workers are dealing themselves with starvation and malnutrition, which is making it incredibly hard for them to do their jobs. Tell us more about your findings.
They're desperately hungry, and lacking water. Most people only have this much a day, and that's everybody. And just imagine you are working incredibly hard, incredibly physically hard, running from patient to patient, dealing with things that you've got to be mentally alert for, but also physically alert for, and you have very, very little food. Now, we are mounting missions as often as we are permitted, and when we come, one of the things that we're asked for first by the healthcare workers is food, and we do our best to bring some. We're also increasingly bringing nutritional supplements for children, refeeding food, because that is now the great need. Starvation is stalking every doorway in Gaza.
When was the last time WHO was able to distribute fuel and other life-saving health supplies to major hospitals in northern Gaza?
We have regular missions, and as I said, it is dependent on them being facilitated or agreed to. We have been, the most recent I've got details of was just a couple of days ago, and we were able to get to the pediatric hospital. Prior to the hostilities around Al-Shifa, we were able to get to that hospital last week, and it was beginning to get off its knees, beginning to provide at least basic services, but sadly we are now seeing, because of the hostilities there, that has been interrupted. And as I said, and what we're doing much more in the north now is looking at how we can set up nutritional stabilization centers for the many, many children, but also adults who are now at a serious stage of severe acute malnutrition.
We have been struggling to communicate with doctors and healthcare workers in northern Gaza. We have an ongoing situation at Shifa Hospital. What is your understanding of the level of healthcare now available in the north?
It's minimal. We know that there were, I mean, before the hostilities around Al-Shifa, 6 hospitals that were doing what they could, but most of them lack fuel. Whenever we go to the north, one of the things we bring is fuel so that they can get their generators going. In some hospitals, we have to repair the generator or bring a new generator because that's been destroyed. It's a lot of the staff, the specialist staff you need. Remember, the injuries they're seeing are horrific burns and blast injuries, and you need to be a very experienced and skilled surgeon to be able to deal with that. So one of the other problems is the staff themselves don't have those skills and don't have the support of the experts because they've either left or died or they've been displaced. So they do their best. They're doing their best, but maintaining just basic hygiene is a struggle.
Margaret Harris from the World Health Organization speaking to us there from Geneva. Thank you so much for your time.
Thank you for having me, Marlene.